Hello, I'm Dr. Manoj Bhatawdekar. I'm a psychiatrist.
Hello, I'm Dr. Anjali Bhatawdekar. I'm a pediatrician. In these sessions on wise parenting, we have been talking about food habits in children. Today, we are going to talk about a very important topic, and that is obesity. Now, you will ask me, is obesity really common in small children? Well, maybe not, but it's a real threat these days. In the lockdown period, we have seen that the lifestyle has changed drastically. So there was no exercise, children could not go out, children were at home all the time, the screen time increased remarkably, and with this, obviously, because the children were at home, they kept eating and eating and eating. So all this had its own effects on the weight of the children. Nowadays, whenever I see a child walk into the clinic, I see the child with a abdominal girth, which was not the case earlier. So we have seen many children who have put on even up to 8 to 10 kilograms during the last 2 to 2.5 years. So it's a real threat. What we see worldwide is that obesity is a lifestyle problem and it's a problem of the plenty. There is too much food available. The affluence of the families has been increasing, and there's a lot of stress in the families, and all this has led to a dramatic change in the food habits of people. But we always think of obesity as a problem of the older people or adults. But unfortunately, there have been many scientific studies in the last 20-25 years in India also. More than 50 studies have shown that the incidence of obesity in children and adolescents is increasing very rapidly. Just to quote a few examples, between the years 2001 to 2005, the incidence of obesity in children was somewhere around 15 to 16%. But in the year 2015, it has risen to 19%. And there are predictions that by 2030, the obesity incidence is going to rise worldwide very rapidly. And the unfortunate part of this is that 1 out of these 10 obese children is going to be from India. Shocking, isn't it? So, what can we do about it? One important thing to remember is that yes, we can do something about it. As we always say, prevention of any problem is much better than curing the problem after the problem has come up. Same is the case with obesity. If parents become aware that obesity is likely to happen when the lifestyle changes, then it is easier for the parents to change their own lifestyle and the lifestyle of their children. We will be, of course, talking about this in detail. But let us first examine what effects obesity has on the physical health of the child or even an adult. Apart from the looks, the obese child obviously does not look very good, but there are many physical adverse effects because of obesity. Obesity can lead to an increase in blood pressure, so hypertension, increase in the sugar levels. So type 2 diabetes is very common in these children. When we were medical students about 30-35 years ago, we would hardly find any young adults with type 2 diabetes. So most of the diabetes would be after the age of 40-45. Nowadays, however, we are seeing a lot of young people, even in their 20s, with type 2 diabetes. And unfortunately, we are also seeing children as young as 12 or 13 years with type 2 diabetes because of their obesity. So, obesity is a real threat because of the diabetes which happens along with it. The other part is, of course, that the lipids are deranged in obesity. Obesity, because of its high weight, has a lot of pressure on all the joints. So, you have joint problems, you have gastrointestinal problems, you have liver problems. These are quite important and these can be really dangerous at times. Apart from this, obesity also affects the fertility of young adults. We have seen many obese girls with what we call the polycystic ovary syndrome, which can lead to infertility. So, all these effects can be really bad for the adolescent or the young adult, And that is why it is very, very important that we become aware of the possible threat of obesity in our country and try and take measures to reduce this incidence. Scientific studies have shown that obesity can lead to a reduction in the life expectancy. And this reduction may be as high as 20 years for a male. That means the male would reduce his lifespan by 20 years. In females, this is reduced by 5 years. But the good news is that if there are lifestyle changes in these obese adults or adolescents, what they find is that the incidence of diabetes, type 2 diabetes, can reduce by as much as 55%. As against that, giving medicines has reduced this incidence only by 30%. Isn't that good news? That means changing lifestyle of obese adults can reduce the incidence of obesity, can reduce the effects obesity has, and can reduce the side effects of obesity.
Just as there are physical effects of obesity, there are psychological effects of obesity too. We find that adolescents or teenagers who are obese have body image disturbances. They are more prone to anxiety, depression. Their self esteem is low. They are bullied and fat shamed a lot. We are talking about obesity as a phenomenon which occurs in later years. Why talk about it in the reference to preschoolers? Because food habits are inculcated in preschool years. The seeds of later obesity are sown during the early years of childhood. So, nip it in the bud is the message. Obesity is to be prevented rather than treated. More about this in the next episode.